Well, Dr. Nguyen, I would like to talk to you about something which I think brings some confusion to some of us patients, and that is missing teeth. When we have missing teeth in the back, we kind of like, nobody sees it, and they don't seem to bother us too much after a week or two of missing. It's uncomfortable stuff is gone, and yet your dentists keep telling us it is very important to replace them. Tell us why there is such a huge difference in what our opinion is as patients and what your opinion is as a doctor. And maybe it isn't true. Maybe the teeth don't need to be replaced. Maybe it's just a money rocket by dentists. You tell us what it really is. That's how we feel. That's how we patients. That's how we patients feel.
I understand.
Kind of why do I have to spend whatever money it is to fix something in the back? Nobody cares. Do you understand?
Yes.
Yeah.
Yes.
Go ahead.
And I run into it on a daily basis, so I understand exactly what is coming. Like from the patient. So let me talk a little bit about that. Okay.
Sure.
It's very important for the back teeth to be replaced. There are several reasons, but some of the main ones are, first of all, you will lose the chewing efficiency. You will not be able to chew the food that you like because the front teeth are not designed for the chewing. Okay? So that's number one. Second, when you're losing the teeth in the back, the front teeth are going to start shifting, meaning that they're going to be like, tilting to the back, and then they start going haywire pretty much because they got space for them to move around now. And that will cause, crooked teeth, and obviously that will not be looking very good. And it also causing your bite to be off, like the teeth are not aligned well, they got, crooked, and then you won't be able to get them together like. And also, there's a very, it could also lead to, muscle have to work differently in order to get the teeth to, to the new position now. And you put a lot of strain on the muscles, and then that, in effect, will cause problem with the joint, the TMJ problem. And that, lead to headaches, neck pain, and a lot of soreness when you chew, and like losing sleep over it, because it's just pretty debilitating, because I've seen a lot of my patients with that problem.
So you're saying, Dr. Nguyen, you're saying that you have missing teeth, and then a little bit like with a cogwheel, and imagine a Swiss watch kind of like having a couple cogwheels being crooked or missing. Obviously it will not be a Swiss watch anymore, right? It will be giving you wrong time. So somewhere along the line things get out of whack, and like a hinge, you use one more than the other one. Something in that neighborhood is what you explained.
Right.
And by doing so, those chars, which I heard, those chars are the most complicated chars in the body. Is that true?
That is true. The joint, you're talking about the joints, the TMJ joints. That is where it's the lower jaw is kind of connected to the whole head, pretty much.
Right.
And that is a very, very delicate area, and it's super hard to treat.
I've heard that. I'm glad you confirmed that. It seems to be that because the jar isn't socked in like a normal one, but it's flat laying and it moves in 4 dimensions. It kind of can move anywhere, which very, very few joints do. So I got that. Wow. So because of the teeth being out of line, and you chew one-sided and all kinds of things, you now make those joints coming out of alignment, and they pull on the nerves, and you now have headaches, neck pains, and shoulder pains.
Yes.
Wow.
Yes, all of that.
So are you telling me that there's maybe some patients out there who have headaches? Because there's lots of people out there with headaches, right? And I'm sure not every headache comes from this, but is it possible that people who have headaches, shoulder pain, neck pain, have gone to chiropractors, maybe got relief, came back, got relief, came back, that then all of a sudden they actually have this problem. If they would go to a dentist, they perhaps could get fixed. Is that what you're saying?
That's exactly right, because most of the majority of, the TMJ problems kind of go undetected, because you would think it would hurt right here. Why would it hurt, like in my head or my neck? But it's because it's like a whole thing that's going together, and then one is out of line, you get the
that
effect.
Is deep. That is deep because, I mean, personally, I'm lucky. I do not have headaches, and only sometimes have a little, neck strain or so. But that sometimes is not a nice day. You can't drive. You can you walk like you're irritated and type of stuff. And I know people with headaches who are very irritated with their kids. They're irritated with their friends.
Personal experience. I mean, you can see that too. Like when you have headaches, you just don't really want to do nothing. Just want to stay, be by yourself, and that's very, very debilitating.
That's a good reason for me to basically replace that. If any other reason, you mentioned, that all the teeth are shifting, you're chewing badly, which affects the stomach, which we get the headache now. Anything else?
And also that could lead to some gum problem, because the teeth are crooked, and now it will be harder for you to get them then clean them, and then you will have plaque buildup, which is like debris from your food, and it could stay in there longer. It could cause the gum to inflame. It could cause the gum to bleed, and then you will have a gum issue, a gum problem, or gum disease, like we call them. And also it could lead to cavities because of all of the debris in there that you cannot clean up, and then now you will have problem, with them staying there too long, causing cavities on the teeth. So there's, and also that gum disease, and we have, studies showing that gum disease is really bad, because it's linked to the heart disease also. And we have mothers, pregnant women that have, low weight child, and having, issue with their pregnancy, and people that have, issue with their heart also. A contributing factor is from the gum disease. They're not getting that under control.
Right, and you have mentioned that in another video. How that really ruins organs in the body, very, very major organs, which once they are ruined, current medicine has a very, very hard time to fix them. A missing tooth is fixed relatively easy. I mean, it does take some work, it does take a little money, yes, but it can be done. A kidney, a liver, or that yellow ugly pus in the placenta and then being pregnant, well, how the heck do you fix that? It's not that easy anymore. Wow. So you really have a whole bunch of reasons here why that is. Now, somebody told me that once a tooth is missing, then the bone where the tooth is in it starts shrinking because it feels like it's not there. It's almost like when you get a cast on your hand and you have it on for 6-7 weeks, your hand will become very weak and very small. Is that true? And because what the person said is that because of the bone shrinking, you now start looking like this old dried out tomato. Like the old people, they have this caved in face. Does that have something to do with it, or is that not true?
Yes, definitely. It's just an evolution kind of thing. Whatever that you don't use, you're going to start to lose it. Okay? So if you're missing a tooth,
so I should use my money, right?
That area,
I should use all my money, otherwise I lose it anyway, right?
There you go. There you go. You don't want to wait on that. But anyway, let's get back to the teeth there. And obviously, if you don't have the teeth in the area, the bone is not being stimulated. It's not being constantly reminded that you need to work. So eventually it'll stop working by shrinking. And they'll do that, over the years, and then to the point that you will start having no more bone, and then, you don't have that muscle attachment. It will you don't have the, what should we say, the support of the bone and the muscle. So now your face is going to change because it will suck in, exactly like you said. It looks like, like you're aging like years, because of that.
Well, I can now understand, why, something which doesn't look big to us and much to us, the long-term effects are almost irreparable. And then the bad part is that very few people will think that they have a headache because of their teeth. I'm almost sure MDs that's not their first way of looking at it. They look at all kinds of other things, imbalance, name it, but not at the teeth, because it's too far. It's not yet common knowledge that happens, I think.
That's true. And like you mentioned earlier, it's in the back. Why bother? You don't see it, but it's got a lot of bearing on everything else. It affects your whole body.
Well, Dr. Nguyen, very insightful. Thank you very much.
Well, thank you for having me.